So I'm not going to play the prelude because that's where we lost you last time.
Okay.
Hello? Hello?
I I can.
Hi everybody. It's Dale Walsh with Straight Sane and Sober, and today our guest is Ann Seig, who is a former psychiatrist and now a life coach, and she has a very interesting story. And basically, I'm going, since I'm the poetic warrior, I'm going to read you one of my new poems before we start. Uh, but so this is called The Only Woman I Crave. It's what I call a Dale, which is 6 words a line and two sets of 9 rhymes apiece. So that might sound complicated, but give it a chance. So it goes, The Only Woman I Crave. You're the one I most admire as you set my soul on fire with a great and deep desire whose flames rise like a pyre. Of your presence I've never tire, wanting with you heir to sire, which would this world does truly require, sunk profoundly into chaotic quagmire, falling in love with your eyes, which with spirit do me mesmerize, as they my senses easily hypnotize with their depths dark and wise, that over my life completely supervise, as your power I do authorize, every morning when I happily arise, again to reinforce our amorous ties, since our intense passion never dies. So that's my latest deal. So I hope everybody enjoyed it, and welcome, Ann. How are you today? We had a
Well,
little problem with the tech, but it's good to see you.
I'm happy to be here. Thank you, Dale.
And let's just get started by getting some background about your practice and your history of I remember that you said that someone who was in the Fugs, which was a. Can you hear me? Okay.
No, I'm having trouble hearing you. My
Okay.
volume is all the way up. Can
Uh,
you hear can you hear me okay?
I can hear you. Okay, I can hear you fine. Can you hear me now better?
Slightly.
Oh well, I guess we'll just have to
Yeah.
speak up a little bit. And uh, so I was very interested in that story that you told about the singer or the musician in the band The Fugs, which got you to apply to
Yes,
medical school.
yes.
I don't know if people know who the Fugs are, but they were like the first like great raunch band from New York City, and they anticipated the punk movement by about 15 years. So, uh, why don't you tell us the story, Ann?
Nice description, Dale. They were the premier funk band of the 60s. I was in college. I was about 27, maybe. I started college at 24. And in my organic chem class, there was a really handsome guy, nice guy. And he asked me to have some iced tea with him one day. And we talked, and he convinced me, even though I was old and had a very odd history, that I could be a doctor. I could get into medical school. I previously had felt that that was entirely impossible and totally gave up that idea altogether. But this gentleman had just gotten into medical school. He was 30. He was a guitar player for the Fugs, and he was a Buddhist monk for 3 years. And he said, if I can get into medical school, you can get into medical school. I had dropped out of high school. I had gone off and lived in a commune. I had a child. I was in an interracial relationship. I did not have much contact with things on the grid until I was 24. And then, I said, okay, I'm going the straight and narrow path. I'll try my best to, get some education, get a job. So when he convinced me, because of his weird history, that I too could enter medical school. I applied to medical school and didn't get in the first year, but the second year I did get in. And I felt
So,
really very grateful. Um,
so you were in an organic chemistry class, right? So were you studying pre-med when you when this conversation took place, or did you?
no, I was a biology major, chemistry minor.
Okay.
Pre med was not on the horizon. Right.
And did you always want to be a doctor, or was that sort of something that you like
No,
give?
no. It was one of the options I had considered and rejected. I thought I would do biology research, possibly, teach college or high school biology.
Okay, so uh, the training for a psychiatrist. Well, you're a retired psychiatrist, correct?
Correct.
So the training for a psychiatrist is very arduous, isn't it?
Yes, medical school is very arduous, and the postgraduate training is semi-arduous compared to the medical school and internship. It's not all that hard, but medical school was very trying physically, mentally, and emotionally. You can't really have much of a life, and you have to have your priorities straight. Medical school is numbers 1 through 10 on your list of priorities. There were regularly times that I was up for 36 hours working solidly, like a couple times a week in certain rotations. I had to memorize vast quantities of information very quickly. It was always pressure until probably probably I got to psychiatry training. Then it was a lot easier. The call, which is when you're up after hours and you're responsible for taking care of patients, admitting patients, that got a lot easier. The psychiatry, in my opinion, the psychiatry at that point was very Freudian. Somebody going into this particular medical school in Colorado, their psychiatry department had a history of being very psychoanalytic. So a lot of the training was in psychoanalysis and Freudian concepts. Of course, we also had to learn how to use medications to help people.
Well, one thing that Dr. Bill Pettit was on this show about 3 weeks ago, and he says that in all his training as a psychiatrist and as a doctor, uh, they talked about endlessly about mental health, mental illness, but nobody ever talked about mental health. Would you agree with that?
Yes,
Did,
mental wellness was not a concept that was promoted. It had some fringe adherents. For example, there was a quite well-known biofeedback specialist who had made a name for himself with a number of papers about using biofeedback for relaxation and pain reduction. So there was a slight amount of wellness and health emphasized, but mainly it was correcting what was wrong and the emphasis was on disease. Yes.
so, what you said that your psychiatry was very directed towards psychoanalysis. Could you like explain that for us a little bit more? I know there are like other therapies now, but how would you explain psychoanalysis as opposed to like CBT or behavioral therapy and uh, so was it all based on Freud, or is that the idea behind it, psychoanalysis, or
Correct,
I
Dale. The originator of the psychoanalytic technique was Sigmund Freud. His viewpoint, interestingly, this is kind of an aside because definitely this was not talked about in my psychiatric training, but he originally treated a lot of young ladies in Austria, where he started out, who had told him that they had been abused by various male relatives, neighbors, friends. And he initially had believed them. And then at some point, he rejected their explanation of why they were having troubles with depression and anxiety, preferring to think that they were imagining this or substituting this reality for what actually had happened, which was that they were attracted to their father or their uncle or their grandfather or whatever male happened to be abusing them. And it was called the Electra complex, and the opposite, where a young man who had claimed to be sexually abused was really attracted to his mother sexually. And because both those liaisons were forbidden, the patient made up this delusional story in their head about having been abused rather than admit that they were attracted to the relative of the opposite sex. So it began, in my opinion, to go south at that point. There are a lot of students and acolytes of Freud who carried on the psychoanalytic tradition, but it was all basically based on Freud's concepts. He did have a slight, in my opinion, accurate view by describing the human psyche as having three components: the ego, which is the part that carries out everyday actions; the superego, which is the part of the psyche that judges and directs
well,
those.
that's basically your morality, right? The
Right,
super.
right, right. So that basically, and the id, which was the unconscious, and basically that was the other component of his theory, that everybody who came to get psychiatric help had to be analyzed with those tenets at the foundation. And basically, you had to talk about whatever came to your mind, and the psychiatrist would then interpret what you were saying to them. And a lot of my colleagues did actually go into analysis, which meant like you went in more than once a week to talk to your psychiatrist, who didn't say anything most of the time, for an hour. And to me, it made no sense. So, as you just mentioned, there are so many techniques that at that time, even like biofeedback that I mentioned, were available. I availed myself of my extracurricular educational opportunities and took it upon myself to train myself in areas that were not formally taught in the curriculum of the psychiatric residency.
Right. So, uh, yeah, I've always said that when I said I was God, it was like my libido just like took over my body, and it's like, but that it's very interesting. I think this is what Freud said, is that, he based everything on sexuality, correct?
Correct.
Basically, he said basically sex was like the basic drive and
Yes.
for, for men. I'm not sure if this is true for women, but for men, the drive to get back into the womb and the comfort of the womb was like the overwhelming driving force behind the sexuality that men and the Oedipal complex. Is that correct?
That's correct. It was similarly so for women. Their primary drive was sexual.
Right. And I guess where Freud went wrong is just like did not. I mean, this is probably a product of his time, but just denying that all these women had not been sexually abused, and they were making it up, right?
Correct. And
And
you're
that's
right. It was a product of his time. I don't know for sure, but my guess is that he was heavily censured whenever he started speaking about this to his colleagues. He got silenced pretty quickly and decided it was not worth his putting his reputation on the line to actually help his patients by believing them, but it was better to separate himself from that initial theory of his. He had to separate himself from believing them.
right. Well, I I never knew that he ultimately denied the fact that the abuse that people that these women would tell him about. But uh, I guess in those times, you know, women. Well, I mean this is very relevant to today with the Me Too movement and everything, and just I mean we're finally getting beyond the point where people react with disbelief to accusations of sexual abuse, and I think that's a very positive thing.
Yes, sir.
So let's uh, is there anything as a psychoanalyst, did you go into analysis as part of your training, or did you like come up with any like deep seated secrets about your childhood or
Oh,
anything?
hell no. Oh, hell no.
So, okay, so you trained in psychoanalysis, but you basically got
I
out of
I resisted tremendously because I was affronted by. I'm sorry, I lost you. What was the question?
you said you were affronted by what?
I
You
was
said you were
affronted by Freud's refusal to believe his patients. That, to
right,
me, is the biggest betrayal of trust, or one of them that is currently available to human experience. When you spill your guts to a stranger and they don't believe you, but you keep going back to them for help, it makes no sense
right.
to me at all. So I
Well,
quickly, availed myself of extracurricular education. I learned how to use hypnosis. I learned biofeedback. I learned cognitive behavioral therapy. They did give one course, I must give them credit, in cognitive behavioral therapy, which was, like a few months long. But I basically, that was at the end of the psychiatric training, not at the beginning, where, in my opinion, it should have been.
right. Well, uh, so so were you were you the only woman in your medical school class, or how many women were there in your psychiatry and your medical school classes? Were you pretty
In
much
medical school, there were 33% approximately women. And in the psychiatric residency class, there were approximately 50% women.
oh, okay. And this is back when in the 80s, 70s, or
Correct. The
so?
80s.
Oh, okay. Well, I'm surprised it was that high. I thought it wasn't until recently that like women had been making inroads into medical profession and everything, and especially into psychiatry, because basically all the psychiatrists that I've ever encountered were all men, except for one psychiatrist in my first hospitalization who was a woman.
Perhaps that's the difference, Dale, between the East Coast and the Wild West.
Could very well be, but uh, so one thing that one thing that's very controversial, increasingly controversial these days, is a medication. And I just, I feel very grateful that I found my medication when I did, and so early. But would you like to comment on, you know, what you see as the I feel that at this point the pharmaceuticals are just coming out with antipsychotic medications right and left to make a profit, and consequently, the doctors are overwhelmed because they don't have any idea what these drugs are, how to really prescribe these drugs, and they have to follow the pharmaceutical recommendations. And I don't know if this is relevant to you in the present,
No,
but well,
I agree with you 100% that big pharma is totally for profit. Yes, they ostensibly have the well-being of the patient in mind. I'll give them a small credit for that, but obviously profit is at the basis of the new drugs that are coming out of the pharma labs. The
right.
old drugs are just as good, like your drug. The old
Well,
drugs work.
that's what I thought too. I meant for a little while I thought that Prolixin was the hell drug. I called it the hell drug, and I got off Prolixin for a while, and went to Zyprexa, which is a second generation drug, and I gained 40 pounds, and my mother got diabetes because of
Oh my
Zyprexa.
God.
So
Oh my God.
and I think the first generations, for what they did, were like perfectly fine, and it's just like the second generation is like, I don't know how many varieties there are, but it just seems like the second generations were like developed just because the first generations weren't making enough profit.
After they went off patent, you got it. That was definitely a motive, though I must say, from my own experience with both generations, that for some people, Dale, the second generation drugs actually did work better with fewer side effects. But it often took a lot of experimentation to find the combo of meds that was going to be effective without onerous side effects.
Right. Well, I was always told that tardive dyskinesia was the reason that the second generation drugs were developed. That the fear of tardive dyskinesia, which is a neurological condition that correct me if I'm wrong, but this is what I understand.
No, you're right.
Neurological
Yeah.
condition that like makes your muscles, especially in your face, like spasm and twitch uncontrollably and everything. And it's not like dangerous, but it's like very, very unattractive. You know, like that and everything.
Yes.
You're doing that all the time. And so I was told that the second generation were developed to avoid tardive dyskinesia, but then they had just as many negative side effects, and ultimately I've heard that, they also cause tardive dyskinesia.
They can. The risk is vanishingly small, even compared to the first generation. But you're right. You can get tardive dyskinesia from the second generation antipsychotics. And what you're doing is you are suppressing dopamine, the neurotransmitter that is intimately involved in movement. When you suppress dopamine, that dopaminergic system can go haywire, and it can just like cause the movements that are not supposed to be going on. You have no control over them. They didn't, in my experience, have any effective treatments. So it was a major push to find another solution with fewer or less risk of tardive dyskinesia. You're right. They did not have statistically any fewer side effects. than the first generation.
Well, as I said, I gained 40 pounds on Zyprexa, and I'm still trying to work it off. So,
Oh, poor baby.
but so let's get back. So your journey continued, and you graduated from psychiatry school, and you became a private psychologist, or did you work in a public situation?
When I graduated, I went into private practice, and it took me about a year to build up my practice to the point that I could actually pay the bills with it. I did not do public psychiatry in terms of working in a mental health center, but I did work at uh, one of the local hospitals in their psychiatry department for a while, and I also did some trauma evaluations for another psychiatrist who had established a practice in treatment of trauma. Worked at the state hospital for a year, which was during the residency, and it was a very interesting experience. Going back to my training in the first year, basically, of psychiatric training, we were all doing inpatient work, and one of my patients that year was there in part because he had attempted to kill his wife. Obviously, he had a mental problem, but the forensic aspect of it was absolutely fascinating. And I was the one who was assigned this patient. So I got to evaluate him psychiatrically as well as forensically, and got to work with one of the world renowned forensic psychiatrists of earlier times, Dr. John McDonald. And I had this experience, which I chose to have. You could sign up for it or not, to go to the state hospital for a year. And I was assigned to the first women's forensic ward at the Colorado State Psychiatric Hospital. That experience was tremendously interesting. So that forensic work became part of what I did in private practice, as well as treat individuals for psychiatric disorders.
So, excuse my ignorance, but could you like define forensic? I mean, I'm not sure what the distinction is between forensic psychiatry and regular psychiatry. So, what's the idea behind forensic?
So many people have said, "You analyze dead people?" Now, the word forensic, I did analyze one dead person, but forensic simply means connected with the law or having to do with legal matters.
Oh, okay. So, like if people needed a psychiatric expert at a murder trial or something, they would call you, stuff like that.
Yes,
Oh,
that's
okay.
exactly right.
So, uh, so how long were you practicing before before you retired?
25 years.
And do you have any impressions or like you like to share about like what those 25 years were about? I mean, were there any great revelations about human nature? Or, I I meant the idea behind therapy is hopefully to help the person realize insights and to be able to, grow and flourish. But that's also true for the therapist too. I mean, if the therapist isn't growing and and growing in insight, then it's sort of like a bad situation, right?
Right. High five on that one, Dale. High five over the video. Oh my gosh, yes. There were so many psychiatrists who had really done very minimal work, and it showed. I think I was very fortunate in that I had a lot of difficulties. I mean, I didn't have made it much easier for me to relate to my patients. For example, when I was a teenager, I was suicidal. And that made me really be able to easily get into the mind of somebody who was suicidal. I didn't have to really guess what it felt like. I knew what it felt like. And I knew
Right.
at least some of the strategies that worked for me to get out of that state of mind. I was very patient centered and basically listened to my patients. And though I was, of course, able to offer things they hadn't thought of, it was really up to them what they chose. I offered them kind of a little bit of a menu, and a lot of the time their choice was to do nothing. A lot of the time their choice was to do nothing about the issues that they were dealing with. And that, I don't know if that separated me from other psychiatrists, but I certainly am thinking of a couple of patients who I've been there for them when others have not, because the other treaters or mental health people wanted them to work. They
Right.
actually wanted them to work on their problems. Oh, yeah, that's what you're supposed to do when you see a psychiatrist or a therapist. But
Right.
in my world, part of what people needed was love. They just needed to be heard and accepted for who they were. And actually, I've had a lot of feedback about how just being kind to people and interested in their lives has been very helpful for them without them having to do a bit of work.
Right. Well, that's that's one thing that I've come up with in my coaching business is this like cookie cutter approach to therapy, and especially to medication, where the doctor doesn't take the time to really listen and try to understand what's going on, rather than just like saying, okay, well, here's 200 milligrams of thorazine, take that every day, and come back. And one thing that I found when I was in my program is that this constant attention to therapy and to understanding your problems was ultimately counterproductive, because if you want to like get rid of a problem, you aren't going to get rid of it by constantly dwelling on it.
Thank you, Dale Walsh. That is awesome. Absolutely. It is awesome. Yeah, you do have to, in my opinion, at least pay some attention to the problem so that you understand the problem, where it came from. But what to do about it was really the important part of it, as you just stated. And helping people with cognitive behavioral techniques was the primary avenue that I utilized. I also taught them how to do hypnosis if they wanted to do it. I did a fair amount of EMDR, and that is related also to right left brain coordination. For example, they say that we have rapid eye movement, or REM, sleep state in our dreams because we are emotionally processing events from our life. So that technique was helpful to people, as well as a technique that's commonly called tapping, that you tap on various
Here we
acupressure
go again.
points on your body while you're stating not only what, yes, you got it. That's it.
I
That's
know
it.
tapping. I know tapping.
You sure do.
And the science behind that is you're tapping into the nerve connections in the body, and basically getting the trauma out of them, right?
That is one of the two common explanations for why it works. The other one is that you are actually activating meridians, which are, to Western medicine, not adequately explained scientifically, but to acupressurists or puncturists, which is a like 2,000-year-old Chinese or 4,000-year-old Chinese healing technique, it's very clear that it works because these meridians carry energy throughout the body, and when they're blocked or they're slowed down or stopped, then certain symptoms are evident depending on the meridian that is blocked. So I'll take both of those
Right.
explanations.
Well, that brings I mean that brings up something that I'm sort of fascinated about is to what degree do you think mental illness is like basically physical with the chemical imbalance in the brain, and I meant to what degree is it like nurture versus nature? Do you think trauma has like a major factor in developing mental illness or not?
Yes, I do. I think there, depending on the person, it really does depend on the person. It has to do with both of those things. I have seen people where it's 99% chemical, and I've seen the alternative where it's 99% the programming that they received in their childhood. So I address both always, even though
Right.
they may not want to work on their programming from their childhood. I still explain that that's part of what's going on to them, whether they
Well,
wish to pursue it or not.
that's the thing. I mean, I was in psychoanalysis with my main doctor for like 22 years, and after a while, you just get tired of like talking about yourself. Yeah, I meant, and so you like sort of direct. I meant, you direct things outward and say, well, everything's fine and nothing's wrong and everything, but that doesn't really like address the problems. But on the other hand, this constant dwelling on the problems has like major effects on your psyche, I think.
You are absolutely right, Dale. That is one of the toxic effects of analytic therapy, that you are dwelling on the problem without learning how to change it. To me, learning how
Right,
to change the way you think about things, the way you feel about things, the way you perceive things about yourself and your life is the name of the game. You absolutely owe it to yourself to at least consider changing the programming, depending, on how much you want to work at it. But
right.
that's why, to me, cognitive behavioral techniques are so important, because they are at least a major foundation, maybe not the only one, but a major foundation in reprogramming those brain circuits that got the negative programming. You provide an alternative.
Well, I'm very interested in programming because I was in the program for 5 years, and I was hospitalized 9 times, and I feel that like it caused. I meant one time I saw my mother's shrink psychiatrist in Oklahoma City, and I just had one session with him in my life, but I told him my story, and at the end of it, he said, "You've been traumatized by your therapy."
Right. Good analysis or good diagnosis. What did you think?
Well, when he said it, I saw that it was probably pretty true. I mean, all the hospitalizations, and yeah, I mean, it used to be when I was in the program, I would feel like I was just about to reach a new level of comprehension and understanding, and when I reached that level, the doctor would say, uh, you're psychotic, Dale, and you're going to the hospital. And they were like, and they like increase my medication in the hospital, and so I'd be right back where I was beginning. And I'm not saying that he was wrong, but uh, I also understand that the people, the other people in the program would react intensely to me when they thought I was going psychotic. But sometimes I just felt, give me a chance. I mean, like, just let me get to this new next level, and then like normalize. But every time I got to the next level, it would be the crab situation. I mean, a crab in a bucket with a bunch of other crabs tries to get out, and the other crabs are all bringing him down, make sure that he doesn't get out of the bucket. So consequently, just I mean, ultimately, I was hospitalized 15 times. And one thing that I'm very proud of is I got out every time. I got discharged every time.
Right on. I am very impressed with your ability to see yourself in a kindly and compassionate light and be able to figure out yourself what is good for you. That was always the goal for my patients, that they would be their own therapist. They would be the one that would be able to figure out what would work for them best. They were the autonomy of the person was always my goal.
Right. Well, whereas I think a lot of psychiatrists just like, I mean, I'm not saying it's an ego trip for them, but they want to like maintain control and like direct the person on how to heal. Whereas actually the person, most of the time, I mean, unless he's totally unless the person is totally psychotic, a person has a sense of like what they need to do to heal. And sometimes, I mean, I think often actually it's like contrary to what the psychiatrist has in mind, and that conflict causes even more problems within the individual anyway.
You're absolutely 100% correct. I cannot tell you how many, as I like to say, messes I cleaned up
Right.
from people who had been traumatized by their treatment. And it never ceased to amaze me how little other healthcare providers actually listened and respected what their patients told them, and were willing to let the patient lead. The patient, like you just said, we as the patient know what's best for us. And if you're not willing to believe us, then I'm not coming back.
Right. Well, I mentioned Dr. Bill Pettit, and one of his favorite one of his favorite stories is did you ever see the movie Sleeper with Woody Allen?
Yes.
But when he first wakes up, they tell him he's been asleep for 25 years, and he goes, 25 years, I could have been halfway through my analysis.
Exactly, halfway. It was never ending. I couldn't even. Oh, well, I agree with you 100%. It seemed ridiculous to me that people were not listened to, that people were not respected, and that the doctor was, like you said, on an ego trip to be in control or in charge of the therapy. My job, as I saw it, was to educate my patients in how to make their lives work for them as best I could. Not that I was going to be in control of their life or tell them what to do. I helped them to manage their lives as best I could. They were in control of their lives, always. I mean, okay, I got to tell you, there were a handful of times that I had to involuntarily hospitalize some suicidal people. I didn't like it at all. It was horrifying to me. I'm one of the few people, I think, in my group of psychiatrists that actually, when somebody said, I'm not going to do anything, even though I have a plan, I believed them.
So I'm just curious, did you? I'm sure you did in your time, but uh, what was your impression of schizophrenia? Because I mean, I was always told that basically I couldn't make my own decisions because I was schizophrenic and my brain was broken. I mean, I think I've said this on the show before, but in my first hospitalization, I was talking to my psychiatrist and I said, why am I here? There's nothing wrong with me. And I realized, 9 years later that I was very sick, but and that's like agnosognosia. But basically, he said, I'd say, why am I here? And he said, well, if you broke your leg, then you would come to the hospital, right, Dale? I'd say yes, and he'd say, well, you broke your brain, and just that like idea of the broken brain and the fact that I'd never be able to like heal or anything. I mean that haunted me for 35 years at least. And
Yeah.
so but this I think that a lot of progress has been made in the treatment of schizophrenia. I think there's still like a great reluctance on in both family members and therapists and social workers and everything to really like let the person rule their own life, because the consequences can be so bad if they do try to rule their own life and something goes terribly wrong. And I don't know. I was just wondering what your impression of schizophrenia that you've seen was.
Dale, you are the exception to the rule. And I think it's because you're so gosh darn smart. I really do. I think it's because you have such an incredibly high IQ and the ability to self observe. I have, minimal actually experience with outside of my hospital training with schizophrenia. There were very few schizophrenics that were in my practice as an outpatient psychiatrist. That was pretty typical, at least in the Denver area, because they were all in the mental health system. That's where the most of them were anyway. That a private psychiatrist saw very few of them was a handicap in me answering your question, but I would try my best to promote the autonomy, and I agree with you that that is the premier goal, to help the person who has to deal with a brain that's not working right to figure out ways to help it to work right, not to give up that it's impossible for them to be in charge of their lives. But you are a shining example of what is possible when you have to deal with a schizophrenic brain. It's just a harder than other psychiatric illness, I think, to be autonomous with. What do you
Right.
think?
I agree, and I mean I read books. I read books about other schizophrenics, and and some who recovered, and some who basically didn't recover, and but I think that every schizophrenic case is completely is a unique case. That movie with Russell Crowe, A Beautiful Mind, about John Nash,
Yes,
the mathematician who won the Nobel Prize, and was a schizophrenic, and that I don't know if you saw that movie, but I'm sure you did. But
I did several times. But you are my John Nash, Dale.
well, thank you. I appreciate that, Anne. And but what I was going to say is, people would say, what did you think of that portrayal of schizophrenia? I'd say, well, it was a very accurate portrayal of what schizophrenia is, but it wasn't my schizophrenia. I meant, for instance, I never hallucinate. I meant John Nash was always hallucinating these, secret agent people and everything. I never hallucinated anything, and if I go down that rabbit hole, I have to conclude that my whole life has been one big hallucination.
Right on.
but I mean, I know it's very hard to generalize about schizophrenia, and I feel very fortunate that I have come out as well as I have. But ultimately, it's a matter of time. I mean, I've been dealing with it for 46 years. So and the last 4 or 5 times I was hospitalized, I admitted myself to the hospital without any doctor's advice because I knew that I was psychotic, So consequently, but I think I've been very fortunate in order to have the awareness and the insight into myself and the illness that I don't think many other schizophrenics achieve, and that's why it's so hard for to get out of the rut of schizophrenia and get out. I was basically on the revolving door entrance to the hospital for 15 years, and
Yes. Well, what do you think about this theory that there are, of course, many parts to all of our minds, and that it's often most helpful to acknowledge that with the person with schizophrenia and help them to identify the different parts of their minds and how to figure out what part had the most, uh, you know, practical point of view.
well, in answer to that, I, a lot of the times I meant basically before I reintegrated completely as Dale, which happened about 2 years ago. Well, actually, it happened in 2017. But basically, I felt that I had like five personalities, and I used to argue with my doctor all the time about whether I was a multiple personality or whether I was a schizophrenic. But basically, and my sister, who's a therapist, deals with a lot of multiple personalities. And she said, I said, well, I can't be multiple because I'm aware of all my personalities. And she says, well, you can still be a multiple. You're just a conscious multiple. So, uh,
Yeah.
but I feel there were like five basic personalities that were comprised that made up this body, and some of the hospitalizations were a result of these other personalities wanting to come out and being taught, hogtied to the idea that I had to be Dale. I meant I had five personalities: Dale, Dewey, Dude, Duck, and Genius. And they all had like their own agendas and their own personalities. And sometimes I think because I wasn't aware that much of them at first, when people insisted that I be Dale, then it would just like drive me to like insane levels of anger because I wanted to be Dewey or Do or Genius, and nobody would like let me be them. And this ultimately culminated when I was I had a vision of the whole world being imploded in a thermonuclear holocaust, and that I called that the death of Dale. And so Dale died. Well, Dale basically relocated, and I became Dewey for 30 years. And Dale thought he was God, and Dewey thought he was an android. And Dewey's programming as an android was stay in Hackensack until Dale gets back. And it took 31 years, but ultimately Dale came back. And when Dale came back, he's reintegrated his whole personality into one personality, and and the sub personalities. I'm afraid we lost her. I guess my diatribe sort of went off base. So uh, let me see if I can get her back. But I so I thought that I had five personalities, and the fact is that um, those personalities were all fighting for control of my body, and ultimately uh, I would go psychotic because I wasn't being allowed to be the person that I wanted to be. So let me try Ann back and see if we can. It's almost time anyway, so. But well, why don't we just end it? Oh, here we go. Here she is back. There you are. There we are. Good to have you back.
And I can hear you. I can
Oh, okay,
actually hear
great.
you now. Oh my God, that was awesome. I really admire you so much, and you really helped me in just telling me about your different personalities, because that to me is one of the most helpful things that every human has. And to get to know the different parts that, sometimes sabotage us if we allow them to. And, that's learning experience. But to be able to say, I can choose what personality is going to be most helpful to me. That's to me the essence of freedom, to be who you want to be. So thank you for telling me how important that was in your healing and your mastery of your psyche. It's beautiful, Dale.
Why, thank you.
You're
And
welcome.
so we have to wind it down now. But do you have any final thoughts you'd like to leave us with, Anne, or just reflections on one thing I wanted to say is I don't know if I told you this, but if you change I to we, then mental illness becomes mental wellness.
That is so profound, Dale. You're brilliant. Absolutely.
I didn't come up with that. I just saw it
Okay.
someplace. But,
Well,
so
it's
I
brilliant.
can't take credit for that. But
I totally agree. That which you feed grows. If you feed the mental illness part of the perception of this problem, then you're going to be in the illness paradigm, and you'll do a lot, in my opinion, do a lot worse than if you accentuate the wellness part of whatever your psyche is doing at the time. There are choices always to be focused on the wellness and to feed the wellness and to empower the wellness. Like Albert Einstein said, you cannot solve a problem from the same mindset that created the problem.
right, absolutely.
So focusing on the positive, focusing on your choice to choose healing, choose positive, even though you don't, know if it's going to work, or you're too tired to do it, to know that that's available every second of every person's life is one of the most important gifts that you can give yourself, or lessons you can teach yourself.
Well,
Choice.
I have been quoting Dr. Bill a lot today, but one of the things one of the things that he says is every moment is a chance to reinvent yourself, and every moment you get a second chance.
Very true. You absolutely do. And you can choose the same old that wasn't very happy, didn't really get you what you wanted, because that's what most of us do. It's the easiest autopilot decision. But you always have the choice to choose the positive, choose the wholeness, choose the wellness, choose the love for yourself.
Well, thank you very much for appearing with me, Ann. I think our audience has probably got a lot out of it, and thank you, Deborah. Deborah would watch this whole show, so I know that she's one of your clients, and just and I think tomorrow with the Warrior Queen, she's going to have the Warrior Princess and the Rainbow Warrior on Warrior TV. And I guess that's about it. But thank everybody for joining us, and have a great time. And thank you very much again, Ann. And I hope you enjoyed this.
I sure did, Dale. Thanks for having me on your show. You're the best.
Thank you.